living on an island out on Catalina. It's good to know that I had Dr. Hutton. We're only a phone call away from emergency care and their fine paramedic crew to keep me alive from Catalina to Long Beach. I nearly didn't make it. So due to fine medical care and air transport, here I am today. Humble.
Critical access hospitals are a new breed of hospitals. They're hospitals that have become emergency triage centers. They have the ability to move a patient to a higher level of care. A critical access hospital is one little hospital with 2 beds, a board-certified emergency physician, and a qualified nursing staff that's linked to the mainland with medical evacuation helicopters. In the case of my patient Brian Dawes, he had presented to the emergency department in peritonitis and was very sick and needed an emergency surgery. He came out of that surgery and was in almost 2 weeks of medically induced coma, but he survived, and he's here with us today to receive his award for becoming the MedEvac Foundation International's Patient of the Year. Santa, tell us what it's like to work in a critical access hospital.
To be a nurse at a critical care access hospital, you really have to feel comfortable from A to Z. You never know what's going to walk through the door. And for those of us that live here, when the winds blow and the fog rolls in, it's usually very perilous for us because medical evacuation is so critical when we have a patient that needs to be on a ventilator or is having an anaphylactic reaction that we can't kind of stop. It just becomes of the utmost importance that we can get out to a surgeon right away for whatever the situation may be.
I would have to agree. Sometimes the hospital is moments of sheer terror, especially when you have to hang on to a patient that you know needs the care of a trauma surgeon or a cardiac surgeon. Oftentimes that can be very anxiety-producing, both for the patient and for the medical staff.
Absolutely.
Critical access hospitals like the one we're sitting at Catalina Island are dependent on medical evacuation. Oftentimes, though, weather can preclude a medical evacuation. Mercier and Air Methods Corporation have teamed to put in what's called a precision GPS approach. A precision GPS approach is like a highway in the sky that allows helicopters to fly in any weather condition and to be able to fly directly into the helipad.
The GPS approach allows Air Methods to fly below the prescribed weather minimums for VFR flight. And since Catalina is considered a rural area, we're the only mode of transportation to get to and from the island is a helicopter.
Brian is no novice to flying people out. He was an EMTD and worked with the Harbor Department for many, many years. Understands what it's like to live on an island, the beauty, the wonder of it, but also it's a place that when you need health care, you need to get out of here sometimes.
Correct, right away. Because every minute can count.